Hey, today the update on the arm. It's been almost a month since I tore my bicep. I tore it on April 6th. Today's May 2nd. Why I'm making a video today is because today is exactly 3 weeks from the had surgery with the distal bicep tendon. And I also went to the physical therapist today. They changed things. The first week with this brace, I was at 75 degrees and it was locked. Then I went to 60 and I was locked. Today I was kind of shocked. They brought it all the way down to 30, which I can't even do myself. So this thing goes straighter than I can let my arm go. All the way to 130. So now it actually has movement and I can move my arm. So like I said, if I was to walk down the street the way my arm is right now, I wouldn't feel like I could straighten it all the way. But it can go straighter than this. I just don't want to push it because I feel pressure, tightness, So she said it's normal on the first day here. She said the next time I come in, they're going to change it to even further, all the way down to 10. So basically, it's like nothing, because I don't think my arms go straight anyways all the way. Like I had to force it to go any straighter. They don't like hyperextend. So, and that'll be the 5th week with this thing on, and that's done. So for me, I never had the cast. I wore this right away. It's going to be a total of 5 weeks. So I'll show you my arm now. And by the way, if you care, see how far it went down? When it went down, it goes that straight. And if you haven't seen the video yet and you want to see my arm pop, you can go on YouTube, look at my YouTube Dave Shea, go into shorts, and there's a video of me in a losing position in arm wrestling. My arm bicep pops, you can actually hear it come off the bone and you can watch it roll up towards my arm. So if you see my two arms right now, I feel like this bicep is lower. I asked them to attach it lower. Todd Hutchings said if it goes lower on the bone, you're gonna be stronger. But see, if I move my skin up, I feel like the bicep's really low compared to this arm. It was always lower than this arm to begin with. And you can see non-flexed, difference in size. Anybody knows me, I always pumpkin train my right. In arm wrestling, that refers to we want one arm to be bigger and stronger. So I never really trained my left as hard as my right. My right arm was a lot bigger than my left. I feel like 1 month after doing nothing with this arm, they're probably pretty close to the same now. You see from behind. I can see some of my shoulder development is gone smaller too. I think a little smaller in the shoulder area. So I'm losing some size, but for reality, for 4 weeks of not doing anything, I'm kind of happy. Most of my muscle's still there. I can still notice swelling because we see right here the redness, and where my band was here. Also, like this big vein that comes down, as you can see, wraps into the cut. See, my vein comes down into the cut, and it should come down. This part of the vein right here, you should see come across like my other one does. You can see how it comes across. You can't see that vein, so this will still have some fluid retention, which I can see it's kind of loose here. And unfortunately, I don't like this too much because my biceps shrink. My skin is starting to stretch as well. Like Mr. Stretchy Man, because I had once, the biggest I've had this was almost 22 inches. And now I'm definitely nowhere near 22 inches. But that's all right, because it'd be the cool part. It'd be like, how fast, when they give me the okay, can I get it back? My restrictions is still I can't lift anything heavier than a cell phone. But the first couple weeks, it was hard for me to use this hand at all. 2 days ago, I started eating with this hand. But when I eat, the supination part is hard, so I kind of just bringing up the food. But the reason why I do that is in physical therapy, I was allowed to move it like this. I'm allowed to move it even more now, so I could probably even eat with the brace on now. I'm a little worried when I sleep if I'm going to stretch my arm out and hurt it and wake up, because sometimes who knows what you do when you sleep. If it straightens out, it's probably going to feel some pain. You see here, I never got any stitches. You can see the weird coloring stuff. That is all glue. So they made this big cut and then they glued it back together. you know, when they did it, there's a titanium button attached to this bone. So far in physical therapy, we really haven't done much. The first day, they took measurements, tested out my left arm. The second day, they told me I can do this, 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 and practice that like 30 times a piece, and then do these things. I also can pronate. I think you can see the difference on 2 hands. These could go down about the same. As far as going back, pretty close to the same. Going down this way, pretty close to the same. Coming up, pretty close to the same. Pronation, I mean, not too far off, but here's what the biggest problem is, and it's with the bicep. One of the main reasons, the function of the bicep attached down here, and one of the main reasons why insurance covers the surgery, and not the one up here, is this is your supination strength. So I can supinate like that. Here I keep going, keep going, keep going, keep going. Right about here I can feel pain here now. And it was the thumb side of the bone, that's where the titanium is. They says, where I feel pain, don't push it. You don't want to hurt anything. And if you remember from my other video, if you watched it, I do have not just reattached, it went up 6 centimeters up my arm. On top of that, it was frayed. So they had to suture the tendon up before they even put the button in. So that's about how my progress has gone so far. What have I been doing in the meantime? Well, I've been focusing on the left side of my body. So I've been, I guess now I'm pumpkin training my left side. I've been hitting my legs hard, trying to get my legs bigger, you know, and focused on my thighs, stuff like that. So I've been training my legs really hard. I train legs twice a week, and I train pretty much every part of my body, the left arm, chest, back, forearms, all that good stuff. Hit it all about twice a week. I do 20 minutes of cardio every day. I trained 19 hours after surgery. I even trained the day after I tore my bicep. So I've taken pretty much 2 or 3 days off of training since I've hurt myself. So as long as I don't straighten my arm, they said I can train and don't pick anything up with this arm. So my belief is by training my other sides of my body, eating my high protein diet, getting my good fats in, it's gonna help recovery on this side. I think the worst thing I could possibly do is lay around and be a couch potato. My body weight is going up. My morning weight, I was around 3% body fat. I'm still real low body fat right now, but I was around 3% body fat the day of the competition at Nationals on the in-body test. I was tested, I had the results, I posted on Facebook, and I was 234 morning weight, and now I'm 241 morning weight. So I put on 7 pounds in a month, you know, but I'm not worried about that. Actually, I want to put some size on my thighs, so I'm increasing my carbs a little bit, trying to get a little bigger, see where it goes. As far as me thinking about arm wrestling, I mean, I love arm wrestling. Will I compete again? We'll see how this heals. But first thing for sure is I'm going to start off slow, and I'm going to start off with a bodybuilding style training, more full range, slow on the eccentric portion, faster on the concentric, mind and muscle connection. You know, I'm gonna take it easy and not go super heavy for a while before I get my confidence back, so I can start pushing it again. But before I even try to worry about strong, I want to get my strength and my size back. You know, I enjoy having the muscle mass, and that's another reason why I've been training. So if this happens to you, I recommend keep training, because instead of losing weight and getting smaller, I put 7 pounds on. So if I can put size on my leg, size on my arm, this is going to catch up. As soon as they give me the okay, I promise you, and I can't wait to show the progress, how fast this catches up to this side, passes it up probably when I get the okay to go hard in the gym again. And that's better just to have one arm catch up to the rest of your body than letting your whole body go and starting over in 6 months, because it's about 6 months, they say, is when I'm allowed to go hard again in my right arm. So that's the update, 3 weeks after surgery. I see my doctor again May 24th. That'll be 5 weeks after surgery. And I'll tell you and post another video then. As far as the brace goes, the next video I post, I shouldn't be wearing it anymore. The brace will be gone. And as far as physical therapy, they recommend 2 or 3 days a week, but those exercises I said, I showed you, I can do that myself at home. So I just come in once a week and tell her I'm gonna do the exercises at home until she's does something that I can't do here, but I don't see any reason to go to physical therapy 3 weeks at home, 3 times a week. I can save time, do it myself. But I have to go there to get the thing adjusted anyway, so I have to go there for that. Hope you enjoyed the video. I hope this doesn't happen to anybody else, but if it does, I hope this video helps you out in my progress and stuff, and how I'm taking care of my arm may inspire you to take care of yours the same way. Most important thing, like I said, stay positive. Don't give up training. Keep eating healthy. I guarantee you won't regret that at the end. If you give up, sometimes you might not come back. Have a good day.